Welcome back to 25 News. Right now we're joined by Governor Greg Abbott. Governor, thank you for being with us today. You know, a lot has happened since we last spoke, and as you know, COVID-19 cases are continuing to spike. Texas is now one of the top states with the highest rates of COVID-19 cases, and it seems like almost daily we're breaking new records. Hospitalizations, as you know, are over 8,000. So do you think that the state reopened too soon?
I don't, and let me tell you why. But first, let me emphasize a point that you just made, and that is it seems like there's a daily increase in the number of cases. And this may come as some relatively new news to people, let's say, in the general Waco area who thought that COVID really wasn't a problem, but yet you saw in the latter half of June how the numbers went up seemingly 1,000-fold in the number of people who were testing positive, as well as you saw a massive increase in hospitalization. So I think Texans are beginning to realize this is serious. With regard to opening up too soon, remember this, and that is regardless of what state you're in or what country you are in, we all know that as you begin to open up, there will be an increase in cases. Remember that California shut down a whole lot longer and a whole lot harder than did Texas. And as California's opened up, they've seen a massive increase in the people testing positive. The same in New York, where everybody knows the story about how New York shut down. But as they were going to open up today, they shut back down because they already saw an increase in the number of people testing positive. If you go back to our timetable, things looked good for an entire month after we opened up. It was the aftermath on the Memorial Day holiday. And when bars opened up, that's when we began to see people letting down their guard and the increase in the transmission of COVID-19.
And
when
so
we
do you
opened
think
up,
that
I made
opening
clear
bars
that if we
was too
did open
soon?
up, there would be the necessity for us to be able to take measures to contain the spread of COVID-19, and that's exactly what we're doing right now.
And so you don't think that opening bars was too soon? Even though, as you just said, we saw a spike in cases, and we do know that those cases that we saw were between the ages of 20 and 40, and that was about the same week. So it's all kind of, you know, it's in the same week. So I think that the opening of bars was too soon.
And I've said that before. I do think that opening up bars when we did was too soon. And candidly, when you consider the setting of bars, you have to wonder if they should have ever been open at all, because bars really aren't made in a way that promotes social distancing, whether it be bringing people close together or people getting intoxicated. It does not advance the cause of controlling a pandemic.
And so how are we with testing? Do we have enough? Is enough being done right now?
So when I announced that we were opening back up, we were testing about 20,000 people a day. I said that our goal was to test about 30,000 people a day. Today, we're testing more than double that, more than 60,000 people a day. And so we have plenty of tests, and the tests are revealing that there are a lot of people in Texas who have COVID-19, a lot of people who had no idea they had COVID-19. And they are the silent spreaders of it because they show no symptoms, and they may go to their parents or their grandparents' house, and their grandparents contract COVID-19, not even knowing that their grandchild may have had it.
And so since these tests are now revealing that more people do have COVID-19, do you anticipate the state shutting down or doing another stay-at-home order?
So what we know from doctors, as well as medical studies, and that is especially with regard to face masks, if people will follow the face covering requirement, that will be able to reduce the spread of COVID-19 enough so that people can continue to go to their job, earn a paycheck, be able to put food on the table, and allow people to operate with some semblance of normalcy. All we need is for people to do that for several months until we get to the time period when we do have therapeutic drugs that will be able to treat people who contract COVID-19.
And so will we have another shutdown, and what does that mean for businesses?
So our goal is to make sure that we put in place standards that will reduce COVID-19 in a way that it will not require another shutdown. And the last thing that we want to do is to shut down, and what I do know for a fact is that if everybody does follow the executive orders that were based upon advice of doctors, we will not need to shut down. Shutting Texas back down should never happen, should always be the last option.
All right, Governor. Well, thank you again for joining us and providing us with the latest updates.
Sure. Sure, thank you. Take care and be safe.